Hello and welcome to this episode of Crate Conversations. I'm very excited to be here today with Dr. Singh from the Pain Management Program at Hackensack Meridian Ocean University Medical Center. Just so you know, the Medical Center is a high-performing hospital in chronic obstructive pulmonary disease, COPD, colon cancer surgery, hip replacement, knee replacement, leukemia, lymphoma, and myeloma, and lung cancer surgery. I'm very happy to welcome you here today.
Thank you.
I understand that this pain management program is new to the Medical Center.
Yes.
And can you tell us a little bit about it?
Yeah, absolutely. Thank you very much. I'm very happy to be here. So my name is Dr. Jagjeet Singh. I'm an interventional pain management physician. I'm double board certified in anesthesiology and interventional pain management. Very exciting times at Ocean University Medical Center. We have created a division and an office on campus at Ocean Medical Center. It's myself, two of our fellowship-trained neurosurgeons, Dr. Arzumanov and Dr. Zhao, and we offer comprehensive pain management and neurosurgical care.
Okay.
You know, the thing is, it's interesting because you have to first understand, for patients, there are different types of pain.
Right.
There's musculoskeletal pain, right, that we can normally think of as sprains and strains. Mm-hmm. There's visceral pain, which can be like abdominal distensions, injury, or inflammation. We can have psychosomatic pain associated with anxiety or depression. We can also have cancer pain, secondary to either mass effect or tumor burden. And then we can also have, very commonly that we see in our practice, neuropathic pain or nerve-related pain, injury to peripheral nerves and or the central nervous system. When you think about, the different types of pains, we also say, well, what can cause these types of pains? And none of these are mutually exclusive, and they're not a comprehensive list, but certainly more common types. As I mentioned, cancer pain itself, secondary to either tumor burden, tumor mass effect, or pressing upon different nerve structures.
Okay.
We can have arthritic pain, as a lot of our patients do. That's very, very common. Neuropathic nerve pain, as associated with disc herniation, sciatica, radiculopathy, even diabetic peripheral neuropathy, we can treat now. Very exciting, different technologies. And then we also have injuries, obviously, rotator cuff injury, sports injuries, so on and so forth, trauma, accidents, and obviously orthopedic injuries themselves can be different causes. Now, we don't expect our patients to know what causes pain. We don't expect them to know what type of pain they have. But what we do offer is that if a patient is having acute pain, chronic pain, that's causing a quality of life issue, or is really, not allowing them to be who they want to be, do what they want to do, we are available to help, and we offer a comprehensive care program.
So I know, I have family members who walk around with pain all the time, and they've just accepted it as part of their life. And that's really not a great thing.
Yeah,
I mean, it's a signal that there's something wrong.
Right.
And you shouldn't really have to live like that, because
Right.
it really does alter how you're living your life or how happily you are. So at what point does someone, if they say, like, all right, I'm having this pain, whatever the pain is, how do they decide, like, all right, this is the time I need to see help? Is there like a threshold or?
Yeah, sure, great question. Everyone has aches and pains. That's normal. That's just part of everyday activities. But, once it starts becoming something that either is new, that you've never had before, or it's something that's chronic, that's starting to cause, like you mentioned, a decrease in quality of life or decrease in function, then it's very reasonable. We have, so in our practice, like I mentioned, we have a multidisciplinary approach. So if a patient's coming in either as a direct or coming from one of our physicians, rest assured that we're able to assess, properly and comprehensively treat the patient. We always want to do conservative treatment first, but we have the ability to treat from soup to nuts, from the beginning, the most common, the most easier treatment options, and it's always based on what the patient obviously is comfortable with,
Sure.
The pathology that's occurring, and really treatment options. And we give them multiple different options, of course, but what options that they're in agreement with. We want to make this a team approach.
Yeah, what they can live with.
Exactly.
Yeah. And you were talking about all different kinds of pain,
Sure.
right? It could be anything from head, neck pain to pains in your legs or arthritic or anything.
Sure.
So, I mean, there's a lot of things out there, I guess, that can cause you to have chronic pain in your life.
And it's a chronic pain issue, which is of course very debilitating, and it's a quality of life and function and ability to function issue. Right. And so in our practice, we work very closely. Myself, our neurosurgeon, we work very closely with neurologists, physiatrists, cognitive psychologists,
Oh, okay.
and orthopedic surgeons. So we are able to assess and treat and able to refer to the appropriate, necessary specialties. If, we want like I said, our conservative care approach comes first, and then always want to advance further along if need be.
That's interesting that you mentioned cognitive psychologists. So, when I think about pain, I think like, oh, I banged my arm, or I sprained my ankle, or I have back pain. But when you talk about a cognitive psychologist, what is why do we bring those types of doctors?
Yeah, so chronic pain can affect every factor of life, including our, emotional and intellectual well-being. And so sometimes it's difficult to control, when the pain is so overwhelming. And so it's not just, it's important to take care of the anatomical pathology, what's causing the pain from a body perspective, but it's also important to understand that there's such a huge psychological component to it that our cognitive and clinical psychologists play an integral part in helping those patients.
Oh, that's great.
Yeah.
So you really kind of touch on every part, and you look at holistically,
Absolutely.
like what, how can we tackle this best?
Yeah, we want to offer, the most exceptional compassionate care available without exception.
So this is a new program at OSHA Medical Center?
Yes, so we actually we're part of the Department of Neurosurgery and Pain Management from Hackensack, Meridian. We're headquartered, we have 3 offices, headquartered in Jersey Shore, here at OSHA Medical Center, and in Red Bank.
Okay.
But our office here in Brick, we have opened up and very excited to welcome our patients.
Yeah, that's exciting. So you're open now?
We are open now, absolutely.
Oh, very exciting.
Yeah.
And you take all insurance?
We are in network with all major medical insurances.
Fantastic.
Absolutely.
So I'm sure you know this, but in case you don't, you've been in Brick before, you know this. We do have a very large senior population that may seek out some of these services. I know I've spoken to countless seniors over the years, and a lot of people do deal with or are living with some type of pain that they just decided they're going to live with. I guess, for myself, I think like, well, if I have to take like an Aleve or an Advil every single day to get through my day, that would be like a good indicator to me. Like, oh, I need to go get some help.
Yeah, absolutely. I mean, like you mentioned, with our patient population here in Brick, a lot of patients wake up with chronic low back pain or dealing on a daily basis with chronic neck pain. These are issues that can very easily be resolved with, like I said, either conservative care, including biofeedback, physical therapy, like you mentioned, low-dose anti-inflammatory trial, and all the way up to, if that works, wonderful. Obviously, less is more. Aquatherapy. And then if that doesn't work, then we can do other modalities, trigger point injections in the office, ultrasound-guided nerve blocks, and then even going up to epidural steroid injections, radiofrequency ablations, smart cord stimulators. For complex regional pain syndrome, we can do stimulators as well as sympathetic blocks. And then if those work from an interventional pain perspective, great. If they don't work, then we have our neurosurgeons come in and evaluate.
Right.
And they can do all sorts of amazing surgeries now. There are minimally invasive robotic spine surgeries. We can do disc replacements. We can do fusion. And so there's endoscopic robotic surgeries. So there's a whole gamut of treatment options available for patients who suffer.
That's awesome. I love that it starts with what's the least invasive thing that we can do to try to solve this problem, and then you amp up as necessary,
Absolutely.
I guess.
Absolutely.
Yeah,
Less is more.
Tons of options,
Yeah.
though. Really, all these
Yeah.
different things that you just named are like fantastic options for people to try out, and it sounds like a great program.
Yeah, it's a very exciting time. Yeah, absolutely.
Yeah, I'm excited
Thank you.
that this is now available in Brick for our residents and for surrounding areas. Is there anything else you want to share about the program that we might not have talked about?
So I think, like I said, we want to treat our patients like family, and I think that's the biggest thing. If you treat patients with compassion, with respect, listen, I've been doing this for a long time, and I still get nervous going to the doctor, and so I can appreciate that. Everyone, that's normal.
Oh, especially if you're already in pain and you don't want it to be worse.
Absolutely, and so we want to make sure that patients understand that we are here to help, and that we will always listen and come up with a treatment plan that's personalized to them.
That's excellent.
Thank you.
Love to hear
Appreciate
that.
it. Thank you.
Thank you so much for joining us
Absolutely.
today. I really appreciate it. We're going to put some information about this up on the screen for you. If you have any questions, you can reach out. And we're so happy you joined us today for this great conversation, and we'll see you next time. Thank you.